you all for joining us. I have the pleasure of introducing Caitlin Coyle and Kathy Burns from the Gerontology Institute at UMass Boston. They were kind enough to work with us and develop a needs assessment in the community of Melrose to decide, what Melrose residents are looking for in their community and, how we can better serve our older adult population. So without further ado, I'll turn it over to them.
All right, thank you, Erica. Can everybody hear me okay? Okay. Yes, so we are excited to be here to finally present the results of this comprehensive needs assessment that we have been working on with the Melrose Council on Aging for about a year, maybe over, and if it is, it's my fault that it's taken that long. And we are here tonight to share with you the results. And so there is a lot of information in the report if you haven't seen it already. What I'm going to present this evening is sort of some highlights, some high-level things, and ending with some of the recommendations that we made in the report. And I know the board and others will have some comments about that and sort of what's already happening and what's to come of this work. So I'm gonna go ahead and get started with a few thank yous, which is to Kathy Burns, who's here with me, my colleague, who really stepped up and took, I had a maternity leave during this project, so Kathy really kept it going. And also Erica and Stacy Minchello, the former director, who also helped get this thing off the ground. And the Council on Aging members who are listed here, John Capuano, who was, I think, instrumental in getting things moving in the beginning as well. And lastly, we want to thank the residents of Melrose who answered our survey, which you'll learn was quite a few of them. And I think really sort of telling that people want their voice heard and they liked the opportunity to be able to do that. So I want to thank them for taking the time and energy to tell us about their experiences. Oh, that looks a little funky, but in any case, why did we do this? What's the background? How did it come to be? What I sort of am on this left side of the slide here is really a few things that we know to be true. One, that there's a desire to stay and live in Melrose, that there's a large and growing population of older residents, and that those residents have shifting and diverse needs. So because of these things, the city and the Council on Aging commissioned this needs assessment to identify and document the needs and interests of Melrose's older adult residents so that we can inform the Council on Aging, we can support its pursuit of designation as an age and dementia-friendly community, and to broadly inform other city departments and organizations who work with older adults. We recognize that aging does not just affect what happens here, but it affects the community more broadly, and so you'll see that the project sort of tried to take that wide lens when we think about aging in Melrose. So what did we do? We started with a demographic profile, which comes from the American Community Survey, which is done by the U.S. Census Bureau in between the decennial census, and it has a lot more detail than the decennial census. It tells us more about, who lives in Melrose and things like living arrangements, health status, income, language spoken at home, race, ethnicity, disability status, etc. So we have a demographic profile of the city, which helped us get started. We did 9 key informant interviews where we sat down with people like first responders, staff here at the Council on Aging, elected officials, planning professionals, to really hear from them about sort of their bird's eye view on the city. What do they see as being, when they think about aging in Melrose from their perspective, what are the things that the priorities or the things that they see as sort of unmet need or needs that are ongoing. And also to kind of place what's happening at the Council on Aging in the context of the city, right, in terms of what else that is going on citywide. We did do 3 focus groups that included residents of public housing, older adults themselves, and sort of what I think of as a community stakeholder group. One of the challenges with this work, as you can imagine, is that we hear from people who are willing to be heard from. And we know there are people in the community who aren't going to respond to a survey. They may not come here to the senior center, or the Milano Center, but it's important to understand what their experiences are. And so we brought together people who we believe who work on behalf of those populations in terms of, meal delivery drivers, direct care workers, sort of faith community leaders, people who have the ability to speak about their knowledge of the more vulnerable segments of the city of Melrose when it comes to aging. So those focus groups really gave us some depth to the 1,396 survey responses that we received to our survey, which was a 28% response rate, which is very impressive. It's one of our highest in terms of response rates that we get on our surveys. And again, I think speaks to people in Melrose they received our invitation to be heard, and they responded. So who did we hear from? Of that 1396, this is the age distribution of them. And I also am comparing that to the age distribution of Melrose's 55 plus population, just to kind of give us a sense of who we heard from. So what you can see, for example, is that we have an underrepresentation of people 55 to 59. So in our survey responses, we only have 12% of people in their 50s. That's compared to 22% of the broader 55 plus population in Melrose. We hit it right on the money with the 60 to 69 age group. So we had 35% of our sample in that age group, slightly over representation of people in their 70s, and also right on the money or very close to the 80 plus. So all in all, when we're going through these results this evening, and when you're potentially listening to this at home at a later time, I think it's just important to remember that what we're seeing as far as results are skewed slightly to this 60, 70, and 80 year olds, and that when we look at age comparisons, including the people in their 50s, that's a smaller segment than the community more broadly. We did hear from more females than males. 64% of our sample was female compared to a 36% male. Not uncommon for survey responses in general, and also relatively close to the age distribution of 55 plus here in Melrose. We heard from people who have been in Melrose for sort of a variety of tenures. So this pie here shows you how long people had lived in the community. So 61% have been here 30 years or longer. So a big chunk, more than half of our folks who responded to the survey are, lifelong or close to it, residents of Melrose. But we did have about 17% who've been in the community less than 15 years. So this is older adults who've been in Melrose less than 15 years, and then 22% who are sort of in this 16 to 29 year middle chunk of time. We also heard from people who are still working. So you also see that of our survey respondents, 61% are retired currently, but a quarter of them are still working full-time, that light blue segment. And 6% are still working part-time, and there's actually 3% of our sample who are looking for work currently. So again, sort of a variety of ages, a variety of lengths of time in the community, although skewed slightly to people who've been here for a long time, and 61% who are currently retired.
On that slide?
Yes.
That slide, on the left, there's missing category, the pie charts, but there's only 4 categories. I don't, one right, sorry about that.
There are 4 colors and 4 categories.
The one on
Oh.
the right. What is the one that's missing?
Oh, the dark blue there. Yep. Well, that's working part-time. Currently retired. I'm not sure, but we'll look that up for you. Thank you. Okay, so the way we've summarized the rest of the results are by key findings. So when we look across the informant interviews, the focus groups, the survey respondents, triangulate all of that information. On the survey, for example, we went through thousands of write-in responses. We coded them, we organized them by theme, we counted them. So what you're gonna see here are sort of all of that information triangulated and kind of boiled up to these key findings. So I'm gonna show a key finding, and then I'm gonna show you the data that supports that key finding, and we'll talk a little bit about some ideas for recommendations. So this first set of slides is about growth in the population. So this slide here talks about overall, so looking for the 2010 decennial census, 2020 decennial census, and the 2030 projections that we have available to at UMass, says that there was an 11% growth in the Melrose population between the 2 decennial census, so overall the city's growing. And the proportion with the most growth is that 60 plus age group. So here is this orange segment of the chart. So you see in 2020, 24% of the community was age 60 plus. That's 27% is what's projected by 2030. And so more than a quarter of your residents are and identify as people who are older adults here in the United States. We ask about how important it is for people to stay in Melrose, and what we see on the other chart here is that for the most part, the majority of people find it very important to stay in Melrose, and that we see a slight age gradation with that. So the older they are, the more important it is for them to stay in the community. And so we're talking about a sizable portion of the city, expected to remain a sizable portion of the city, if not grow slightly, and people who want to stay here. Why do they want to stay here? Well, we heard from them. This is the top 3 things. As I said, we went through all of those write-ins. We counted them, we categorized them, and the top 3 things that people value about living in Melrose, number 1 is a small town feel and a sense of community. Number 2 is the proximity to Boston and amenities. And number 3 was the walkability of the downtown and outdoor spaces. So this is what people like about it, and these are quotations directly from residents who wrote in to articulate some of those issues, some of those things that they appreciate. So for example, somebody down here says they appreciate the ability to walk around, do errands, that we have options for groceries, restaurant, pharmacy. There are things here. They don't have to go outside of the city for those things. So these are the things that people really value. On the flip side of that, we asked about what concerns people about being able to stay in Melrose as they age. Number 1 is affordability, and that sort of fell into two categories. 1, taxes specifically. So people said it's not just about affordability, it's about the taxes, and subsequently about housing costs, and that includes rent, mortgage, but it also includes utilities and home maintenance. So people talked about just in general being able to maintain their housing, and the affordability associated with that is one of their biggest concerns about being able to stay. Number 2 was a concern about being able to live independently and maintain their health and function. So people are interested and concerned about being able to stay mobile, stay functioning. And they're worried about access to in-home supports. And the 4th is that they are concerned about their older residents' concerns are not adequately considered in local decision making. So people are really wanting to make sure that their voices are heard and represented. So these again are some quotes about that. And I will say that we did this survey over a year ago, about a year ago, I guess. So there was different political times here locally and a different administration, and so some of that might be reflected in that. But I think overall what we can say is people want to be heard and they want to feel like they're represented in local government. So main finding, number 1, financial security is a crucial issue facing older adults. It was number 1 in terms of people's concerns about being able to stay here. What you see here is median household income compared by age. So this bottom set of bars is for the household people who are 65 plus in Melrose. So you see about 40% of older adults are living on a median household income of less than $50,000 a year. That's compared to just 16% of younger residents of Melrose. And you can see that overall there's just more socioeconomic diversity in the older adult population compared to the folks age 45 to 64. When we asked survey respondents about whether they believe they have adequate resources to meet their basic needs, 12% said that they do not believe that they have that, the sort of things to meet, so things like food, home maintenance, personal health care, and other expenses. So that seems like, so that's a segment of the population who is acknowledging that they don't have what they need. And then I think also just recognizing that there is a different sort of socioeconomic context when we think about older residents themselves. So in housing, the current housing stock in Melrose is not age friendly and requires home repair, maintenance, and modifications. We asked whether people's current residents have a bed and bathroom on the entry level, so basically they can stay there without needing to navigate stairs, and 56% of respondents said no. They do not have that scenario in their current home. We also asked about their current residents needing repairs, so things like sort of acute things like a roof or electrical work, sort of significant repairs in order to improve their ability to stay living safely for the next 5 years. And you see that 38% say yes, more than that actually, 44% say yes. But of those people who say they need a home repair, 12% say they cannot afford to make that repair. So that's interesting for a couple reasons. One is it sort of aligns with that same 12% that said they don't have money to meet basic needs, but also because there is a relatively sizable chunk of people, 32%, a third, who say, yes, I need these repairs, but I'm not, so I can't afford to make them. So 26% say I need it and I can't afford it. So then the question is, if you can afford it, why aren't you doing it? Which I think speaks to a lot of other issues, like being able to find and trust contractors, and really just the mental planning and management of a project like that can be overwhelming for people. So there's a lot of reasons to think about that. And then obviously those who are not responsible, we assume are renters of some kind. We asked people about what kind of housing they would like. So we assume that everybody wants to stay where they are. So we kind of prompted them. The question was sort of like, if you had to move from your current residence, what kind of housing would you prefer in Melrose? And this is by age. And so what you can see really is that for the younger groups, so the 55 to 59-year-olds and the 60 to 69-year-olds, they want a smaller single-family home or a condo or townhome. So they want that sort of true independent sort of community living. For people in their 70s, we're also looking at people who want a condo or townhome, but also 55 plus community. Again, so thinking a little, still independent, but a little bit more options for supports. And for folks 80 plus, they're interested in this assisted living as sort of their number one choice for housing in the future. When it comes to transportation, specifically for those who have limited driving capacity, local transportation being inconvenient or unavailable, and physical mobility limitations are the most commonly reported challenges. So this graph shows you the driving status of our survey respondents. The light blue here is people who say they limit their driving. So they still drive, but they might not drive at night, they might not drive on highways. And what you can see is a big sort of shift as people age of them sort of changing their driving behavior. And then you've got the brown up at the top is people who don't drive at all. So 4% of people in their 50s don't drive at all, and that goes all the way up to 22% of people in their 80s who are not driving. So among people who, so for everybody on the next one, we asked, did you have to miss, cancel, or reschedule a medical appointment in the last year because of a lack of transportation? What you can see is that people who drive themselves had very little trouble with that. Only 2% said yes. But when we look at non-drivers, that rose to 26% of people who don't drive say that they did have to miss or reschedule a medical appointment because of a lack of transportation. And 9% of people who limit their driving had that same scenario. So it's one of those things when we think about transportation, it's important to think about the different versions of need for transportation, and that in this case is looked at by driving status. We asked for people who don't drive at all, we asked, how do you get around? Number one was 55% said that their spouse or children drive them, so relying on family. A third, walk or bike. And the third sort of highest ranked way they get around is the MBTA buses. For those who limit their driving, so they still drive sometimes, but they're changing that. So most people, so of them, they drive themselves, they also rely on family, they take the orange line, and they also walk and bike. So some similarities between these groups, I think in terms of the reliance on family, walking and biking being some sort of commonalities. When it comes to outdoor spaces and buildings, we asked a number of questions about this. This is really because this sort of age and dementia-friendly community model really speaks to the built environment and how are we creating supportive spaces in our city for that. So we did ask some questions about that, and what you see is that the things that this is what people were most dissatisfied with. So we are showing you the highest thing, the things that people were the most dissatisfied with were conveniently located public restrooms, availability of benches or shaded seating, and availability of public parking. So those, when we think about the built environment in terms of age friendliness, these were the things that came to the surface as potential needs. A lot of caregivers, so we asked about, do you now or in the past 5 years provided care or assistance to someone who is disabled or frail? Over half of people in their 50s and 60s said yes. 46% of people in their 70s and 35% of folks in their 80s. So there's quite a few people out there who are caring for family or people in their lives who are disabled or frail. We asked why they're providing that care. The number one reason was mobility impairment. So 52% of caregivers said they're providing care just for that sort of physical ambulatory support. Second was because of a chronic disease, and third was because of Alzheimer's or dementia. So a quarter of caregivers report providing care for Alzheimer's or dementia. So all of those things I think have implications, A, for what people are doing with their time in terms of providing care, but also for some of the conditions that are impeding people from being able to participate in the community more broadly. We asked about how difficult it was for those caregivers to do the caregiving and meet their daily responsibilities. That's over here. And what you see is that, especially for the folks in the younger age categories, they reported it being, a third reported it being very challenging, and another third, more than a third, reported it being somewhat challenging. So people are doing it in high numbers, and it's challenging for them. We asked about what would have been most valuable to you, or what would be the most valuable thing to support you in this experience. Number one among caregivers was informal support from family and friends. And number two was formal in-home caregiver or homemaking services. Interestingly, number three was on-call support from medical professionals. So people wanting, when they have a question or they're concerned or they're a little worried about something, they want to be able to just pick up the phone and just sort of be reassured about what they're doing. We did ask a lot of questions about social connection, and this sort of summarizes that there is a portion of Melrose residents who we identified as being at risk for isolation. A couple of ways we did that. One is this chart here sort of shows the three different ways people can connect. So talking on the phone, social media, or sending emails or texts, or getting together in person. And what we see on the in-person in particular is that 38% of the sample of the respondents say that they get together in person with somebody once a month or less, or a few times a year. And so we think about that as, not necessarily truly socially isolated, but certainly people who are having less social contact than average. We also asked whether people know someone living nearby on whom they could rely for help if they need it. Again, 12% said no, they don't. And that was actually slightly higher in the younger age groups. That's not shown here, but it was slightly not significant differences, but it did trend to be that the people in their 50s and 60s were less likely to know someone nearby. So who are they calling if they don't have someone nearby? They're probably calling 911, or they're calling the Council on Aging, or they're calling a sort of a more formal support system. Speaking of support systems, we asked about neighbor relationships. We asked if people would ask a neighbor for help if they needed it. And you see that most people said yes, but there is 35% of people who said no, they would not ask a neighbor for help if they needed a minor help with something. We asked if you provide help to neighbors, and 45% say, yes, I do. Very few people said, no, I don't provide any help. But actually, 46% said, no, I don't do it, but I would if I was asked, which I think just sort of highlights two things. One, people are bad at asking for help, which, I think we probably can understand that. But also that this idea of being asked is really important. People aren't necessarily going to do it free will, but if you ask them, they are willing to help. So the Milano Center, we asked about whether people use the Milano Center or not. What you see on this line graph is that it grows with age, which is a trend that we would expect, and it's something we see when we do this work in other communities. So only 10% of people in their 50s reported having ever been inside the Milano Center, even if it was just one time. And that steadily grows until about half, 50% of people in their 80s have been here. Of the people who come, who have ever been to the center, we asked them, how frequently do you come? And what you see is that 44% of people who said that they've ever been here said they come only a few times a year. And then it's pretty evenly split between people who come on a weekly basis versus a monthly basis. And that's actually, that just sort of, I think, highlights that there's sort of varying degrees with which people rely on the center and interact with the center to understand sort of its usership. We asked what limits people from coming here. And this is what you see here as a comparison between people who participate currently and people who have never been here. And so the dark blue is people who've never been here, and the light blue are people who do participate currently. So what you can see is that for non-attendees, the number one reason that they don't come is they don't feel old enough to come. And that is closely followed by, I don't know what is offered, and I do not need the services that are offered. So the takeaway I have from this is that a lot of it is about perception of self and also perception of the community. And so you've got people who aren't identifying with their age, and they're saying that that's something that limits them, and also that there's a perception that they have to have a need to come here to demonstrate a need, and that the I don't know what is offered is obviously a communication and information issue, which is kind of a constant ongoing thing. I would note also that of users, the number one thing that keeps them from coming is they don't need the services. And so that's another sort of about this sort of perception of need that I think we'll talk about. People sort of feel like you have to sort of be needy to come to the Milano Center. On a sort of flip side of that, we asked what would make it more likely for you to come? And again, comparing users and non-users. Among non-users, number one, again, is if I had more knowledge about what the programs and services that are available. So it goes back to that communication piece. And for current attendees, the thing that would get them more likely to come is if the programs and services were better suited to their interests. So you can see that there's differences in other parts of that, but those were sort of the big hitting items. So they said so what are their interests and what do they want to do? And this is a busy slide, but I'll try to call out the things that are most sort of relevant, or what I thought was sort of striking. So we asked about thinking about your own future needs and interests. Which of these types of things would you like to see more of at the Milano Center? And there was actually sort of a trend, even between users and non-users, towards this sort of educational programming, fitness, technology skills, performances and presentations, indoor exercise, outdoor exercise. People want to better themselves. So indoor exercise, outdoor exercise, learning, skill building, culture, performances. That's what people, on both users and non-users, that was sort of the trend that we saw in terms of what they're looking for. We asked about how people we heard that people don't know what's going on here, and we asked about we asked about some questions about communication. One being, would you know who to contact in Melrose if you or someone in your family needed help accessing social services? And so the options to answer were yes, which is the dark blue. The light blue is yes for some, but maybe not all. So meaning I might know some people to call, but I don't know somebody to call for all of those things. And then the brown is no, I don't know who to call in the community. So you can see that about 47% of people in their 50s said no, I don't know who to call. 40% of people in their 60s. That drops off to 28% of people in their 70s and 24% of people in their 80s. 28 and 24% still sizable in terms of the amount of people who say they don't know who to contact. But I think we see some slight age disparities, age differences there. So where do they get information? We asked about where they prefer to find information. This is by age. And what we see are that the younger, sort of 50 people in their 50s and 60s are really looking for the website, City of Melrose website, and local papers. And for folks in their 70s and 80s, the Milano Center newsletter is number one in terms of where they want to learn about what's going on. So those are sort of some of just the high-level findings. I'm not gonna read all of the recommendation slides. I'm gonna kind of just walk us through them a little bit, and then I'll turn it over to the board and to others for some comments. Financial security, top concern includes rising taxes and costs of housing. So these are recommendations that are meant to be suggestions for places to start. They're not prescriptive, they're not a to-do list. It's really sort of saying these are the things that rose to the top for us, and here are some ways we've seen other communities or we know about that you could explore in terms of recommendations to address the need. So really educating people about aging in place and what that means, getting people to think ahead about ways to use their home equity or alternative housing models, or if their house isn't going to work for them as they age, which we heard about, what are the ways they can address that head on instead of waiting for it to become overwhelming. There are existing tax relief programs, thinking about the additional exploration for exemptions, And there's all kinds of sort of property tax freezes and things going on, that you can explore in terms of how to relieve older adults of the property tax burden. And then also thinking about senior discounts at local businesses to try to just ease some of those day-to-day costs. Housing maintenance and repair. Obviously, developing downsizable options is a big deal. We know there's lots going on around housing, and so we are acknowledging that we heard about that, but we also heard a lot about the home maintenance and repair. And so thinking about Council on Aging and what they can do, making sure people are aware of online resources where they can try to find those local providers, maybe helping people navigate some of those things like Angie's List or Home Advisor. Thinking about developing a local fund to help people offset costs of needed home repairs in sort of a crisis. If somebody needs a hot water heater in January, is there a way for the community to sort of gather around them to help make that repair? Accessory dwelling unit zoning is an option for thinking about housing alternatives. And then we heard, especially from the Melrose Housing Authority properties, thinking about how to create even minor updates to that or a way to connect those residents with support around repairs and maintenance. We heard about we need more senior transportation services and wider geographic coverage to address increasing demand, and specifically thinking about the fact that the people who are most reliant on that transportation are people who have physical mobility impairments, who are older. So we heard that a lot of folks in their 80s aren't driving, and that people who have physical mobility challenges. So thinking about that as we think about transportation options is important, and these are just a couple of other sort of ideas for how we might deal with that. So we heard about people not knowing what's going on or what's happening at the Milano Center in particular. So thinking about how to increase awareness of programs and services and what's available, and sort of that's an ongoing effort. So thinking about welcoming first-time participants, trying to, sort of introduction to the Milano Center, sort of here's how to use the center, sort of sessions a couple of times a year, maybe to think about organizing people around advocacy or civic engagement as a way of connecting residents both with what's going on here at the center, but also more citywide. And ongoing, we heard people want new and different kinds of programs, and so really thinking about how to refresh the programs that are offered here, really focusing on what we heard is those things people want. They want to learn, they want to be physically active, they want performances, access to culture and the arts. Caregiving is a big deal for a lot of people. Often it's invisible. They're doing it. They're not here because they're busy doing that, and it's challenging for them. So some ideas, we heard about the people just want someone to call and say, hey, this is happening, and I just want to be reassured that I'm doing the right thing, et cetera. Respite options, as well as just, any way we can get respite to those folks in either a one-time fashion through like a caregiver's night out or something more ongoing as far as a program. Risk of isolation for older residents. So, we like I said, we sort of identified there's this segment of the survey respondents who are at risk for isolation. How do we keep them connected? How do we keep other people from falling into isolation? Again, some ideas there around sort of the built environment and how do we keep people out and about in the community? And part of that is them feeling like they can access the community, either walking or driving. And so thinking about things, we heard about bathrooms. We hear about bathrooms all the time. I can tell you it's probably one of the number one things we hear when we do this work in other communities. And it's a big deal for people who are thinking about going out and walking and being out and about. It's important for them to know that and feel reassured that there are bathrooms out there. So with that, I know that was a lot of information. I hope that you have a chance to take a look at the report and digest it a little bit more. Thank you for your time and for listening to us this evening. And my email is here, and you're welcome to be in touch if you have questions after today's presentation or you want to dig a little deeper into a particular topic. We are happy to provide more information to you. Thank you.
Ooh, sneaky email.
Sorry.
That's okay. Okay. How do we make it bigger? All right. Thank you to Caitlin and the whole team over at UMass Boston. A lot of work and time and effort went into this survey, and we're very appreciative of all the hard work and what they put into it. So, the Council on Aging board and I'm very blessed to have an amazing board. They're very hardworking. They are a working board. We meet regularly. It is not a sit and show up and get your participation medal board. This is, folks who are invested in what we do and want to make improvements. So I'm very grateful for them. We have 7 members. We meet monthly. We have taken the time to review this report in depth and propose some action items that we can, logistically achieve. I think a lot of things in this report, there's a huge range in suggestions and feedback from a micro level of, how do I sign up for the Council on Aging newsletter to a very macro level of, how do we fix the housing crisis? So, I just wanted to mention that, we're going to do what we can on our level to make improvements, but we do acknowledge that some things will take a little more investment and, a greater involvement from folks across all areas of government, whether that be local or state or federal. So just a little caveat. So the board and I have looked into the 5 main topics that UMass has kind of laid out for us as the priorities to focus on. So today we've come up with just a few things. We've started looking at some options and have identified things that we would like to look further into to try to develop for the city of Melrose. One thing that really surprised us was how many people don't know about resources that already exist. So one of our big priorities is, how do we reach those people? How do we get these existing resources that are so valuable and underutilized to people so that they can become useful to more individuals? So in that vein, some things we've already started working on, some things we're, looking into. We are trying to increase our social media presence. We realize that as older adults there's a shift in generations. So, how people access information is changing. So we're trying to have a stronger social media presence. This meeting is going to be broadcast on MMTV. So folks who maybe couldn't make it out here tonight, whether it's due to time commitments, whether it's due to accessibility or mobility issues, will be able to view this presentation at home on MMTV or in their archives. So we're really trying to push more of that and see if we can get some of our educational opportunities to be broadcast that way. So for whatever reason you can't make it, it's available. Or, if we have a lecture on a certain topic, I'm not going to have that topic the very next month. So if you missed that one, you might have to wait a whole year to get to the next, the next topic, the next presentation on that topic. But if it's in the archives at MMTV, if you missed it, you can just go in and see our presentation. So, folks won't miss things. We're also just trying to be more involved, with the mayor's office. They send out weekly updates. So trying to be better at communicating our own programming and our own, things that we want to highlight with them. So the first main topic we looked at was transportation. So our subjects to explore, we want to look at discounts that might be applicable for older adults, and then education around the use of transit apps and the ride. So we hear a lot of confusion about, how to access the ride. We can definitely work on strategies to help people access that. A lot of people don't know about the Ride Flex, which is a really great option that works with Uber and Lyft. So we're looking at developing some resources so people can learn about that. We've brainstormed a few ideas about, how to, even simple things as how to use transit apps to pay for parking, field trips to Oak Grove Station or the commuter rails to show people how to use accessible features at at these public places. And then we also would like to look at, what state and local discounts apply to folks. So for other modes of transportation, we're looking to, delve into taxi and rideshare service information. Maybe we work with our tech people at SDM to have information on, how to use Uber, as simple as that, and have resource guides available to people that they could just pick up and learn how to use it. We've heard about Boston Hospital shuttle information, so we want to look at that and see if that can be applied to folks in our community. So lots to explore. We have also increased our traveling destinations for the COA van transportation since the survey has been taken. So we'll now go to Woburn and some other spaces that we couldn't make it out to before. And, we prioritize medical rides. So we're trying to get people to where they need to go if it's an important appointment. And then, thanks to State Rep Kate Lipper-Garabedian and Senator Lewis, we've secured a $50,000 grant for a new van. So trying to upgrade our fleet with accessible options that will keep, Melrosians able to use our services for the long term. So for programming, we are looking into how we can work with local organizations. I hate reinventing the wheel, so let's use what is available in Melrose already and try to build on that. There's so many great local organizations we can work with. Nutrition programs, caregiving support groups. We also want to enrich retirement. So, we heard that some of our lowest participation age group is younger, older adults. So trying to get programming on retirement, whether that be sharing stories, how you're going to fill your time once you retire, tips and tricks, and, sharing skills and activities. For programming, we've also increased the pages in our newsletter. So, we heard that folks really utilize that as a resource on finding out what's going on. So we've added 3 pages since this survey went out. It's crazy. I thought we were going to have all this room, and the first month we had 3 pages, I ran out of room again. So it just kind of shows, we're always trying to upgrade and fit as much as we can into the space we have. We have added 3 new fitness classes since the surveys come out, so we are really trying to be diligent about, taking these recommendations and community feedback and trying to give Melrose residents what they're looking for. I'll just plug James Conforti, our new Milano Center manager, has so many big ideas. Sometimes we'll say, no, we won't say too big. But, he's so creative. And I think just since the surveys come out has really expanded our offerings and kind of bumped things up to the next level. So we're happy he's here. We're happy to work to get some Welcome to the Milano Center events. I think that's a great idea and, super manageable for our staff. We do that on a daily basis anyways, but to invite people who might be too shy to come down by themselves, and put themselves out there, I think that's a great idea. So we will work on that. For housing, so we'd like to expand the Senior Information Fair, which is coming up this month, October 29th at Memorial Hall. From 10 to 1, you can go and many city departments will be there. You can get kind of a one-stop shopping done, whether you're looking for tax abatements, water sewer discounts, library card, anything and everything the city can offer, we'll try to have there, as well as other organizations like Project Bread who can help you sign up for SNAP or fuel assistance, things like that. So that's a really great resource. We want to keep expanding that. This year, the Melrose Housing Authority will be there, so we're trying to foster good relationships with them and make sure that we're involved in their activities and they're involved in ours. So we're also looking at reaching out to again, local organizations, local businesses, realtors to talk about different housing options, whether it be estate planning or even things like decluttering can be helpful to the housing situations. We'll also coordinate with city officials to learn what exists now and what plans we can put in place for the future. I know in August, the accessible dwelling unit legislation changed, so we'd like to look at that and see, how we can be involved there. Lots of tax exemptions. Like I said, people don't know about some things, and we're trying to push that out. So if you don't know, the property tax work-off program, which folks can qualify for up to $1,000 benefit, is expanding next year, the 2025 calendar year, up to $2,000. So that could be a huge help for people who are struggling with the cost of housing and daily living. And again, we'll try to expand workshops at the Milano Center to include, all of these hot topics. Financial security, we are looking to expand our aging in place workshops. In our newsletter, we're trying to condense things. So instead of, different programs being scattered around the newsletter, we're trying to condense it so that if you're looking for an educational opportunity, they will all be in one spot, and you can kind of plan out your, your month, your month ahead to see, what you're interested in and what's going to be important for you. Like I said, we're going to try to record those and make those available. We're going to look at government subsidy information. We're going to look to investigate senior discounts with local merchants. So stay tuned. Let's see. And then resources. Again, we're really going to try to create a catalog of things that are available already, and try to build on that. So we're going to try to create a resource guide for folks. I think there was one a few years ago that circulated throughout Melrose. We're going to try to recreate that and try to get it updated as things update, so folks can have all information in one place. Like I said, we'd like to do the Welcome to the Milano Center sessions. Folks, I think you mentioned that folks are looking to expand programming with, what they're interested in. We discover all the time we have such a wealth of knowledge in our residents who, maybe they had careers in different fields or just an interest. So try to bring those people out and share their knowledge with others. We have a lot of programs like that where it's completely participant run and led, and it's easy on our part, and somebody gets to share something they're really passionate about. So we like programs like that. We're also working to update and monitor the website with more resources. I think that's a big city push as well. We're looking to get that current and up to date. So we are working with that. We do have a grant that we've accepted recently to build capacity for age-friendly and dementia-friendly. If you don't know kind of that movement, you can be designated as an age-friendly, dementia-friendly community, which basically just means you're accessible to all folks who live there, but with a big push for dementia and age. So we're going to use that grant, one, to create that resource guide. We'd like to create a accessibility map, if you will, of Melrose. Bathrooms will be on there, so where you can plan out your route. If you're walking, from the McCarthy House and you have to go down to Shaw's, you'll be able to look at the map and see, where you can stop and rest at a bench, where there might be an accessible bathroom, where you might find a shady spot to sit. So things like that are in the works. So stay tuned for that. So thank you all for coming. I'm happy to stick around and answer any questions. I think UMass Boston will stick around for a few minutes. And we do have someone from Lauren Grimmicks from the mayor's office here. So if you have any burning questions you want to ask, we'll be around. Thank you all for coming.